Hey guys, Dr. Charles Fino here from Fino Family Chiropractic and Wellness in Palos Heights. And today we're going to talk about a huge misconception with back health. And that is, what is a good stretch or what is a good exercise when your low back is bothering you? A lot of times when patients come in, especially for their initial consultation, I'll ask them what have they been doing for their back pain. And they say, well, I've been trying to stretch or I've been trying to do things at home to alleviate some of the discomfort. And one of the things that actually comes up most common is that people are trying to come down and touch their toes to alleviate this back pain or sciatica or whatever they have going on in that area. And that's actually one of the worst things you could be doing for the condition. These issues in our low back actually typically occur from repetitive flexion or repetitive bending in the low back. And that could be done at home, lifting kids up. It could be done at work with lifting items. And it could be, as easy as just sitting on a regular basis. When we're sitting, our low back is typically in flexion, again, in a bent position, and that puts a lot of pressure on the discs. The disc itself is kind of the consistency, or the inside of it is kind of the consistency of toothpaste. So as we move around, as we lift things, as we bend, that disc contents is meant to move a little bit, basically to absorb shock. But as we're in these same positions over and over and over, sitting and or bending on a regular basis, that disc contents always wants to go the same direction. So if we think about bending forward, for example, when we bend forward, let's think about a tube of toothpaste. When we squeeze the front of the toothpaste tube, that contents of the toothpaste then wants to go backwards. That's exactly what happens in our low back. The disc is the cushion, the consistency is toothpaste. As we bend forward, we're squeezing the front of that toothpaste tube and the toothpaste wants to go backwards. That's where the nerves reside. And when we injure those nerves, that's when we then feel pain and or sciatica. So in a more realistic situation, what we want to do when we do stretches is potentially go backwards, do the opposite, try to reverse all the wear and tear of sitting and of bending forward constantly. When we go backwards and stretch in that position, what's occurring is we're basically squeezing the back of the toothpaste tube, forcing that disc material forward, alleviating some of that pressure, irritation, inflammation on that nerve. So if you have any questions about your low back pain, sciatica you may be experiencing, give the office a call, 708-926-2854, and I can answer some of your questions here for you. I hope you guys have an absolutely wonderful day, and I hope this short video helped you guys out. Take care.